Hello everyone, welcome to my channel Medvitamin, where I'm gonna share certain short topics that will boost your confidence for NEETPG and INICET exams. So the first topic that we are going to discuss will be stains in pathology. Now, number one slide will be about hematoxylin and eosin staining, that is also known as H&E staining, where the blue structures represent the nucleated structures and the rest will appear pinkish. It tells about the pattern, the shape and structure of cells in a tissue and hence helps to identify cancerous structure. So if you are finding a slide fully pinkish, it could be a case of necrosis. And in skin, the stratum basal layer, as it is nucleated, it will show bluish color. The next slide is about Leishman stains. This one is an important slide because this is a previous year question. This has been asked in INICET last year. So this basophil having bluish granulated structure. This is eosinophil having pinkish granulated structure. This is neutrophil with multiple bends in the nuclei. These pinkish structure are the RBCs, and this one is lymphocyte, and this big structure, this one is monocyte. So Leishman staining is basically used for routine CBC. Now going to the next slide, this is about supravital staining or also new methylene blue staining, which shows reticulocytes, and hence this is helpful to identify condition where reticulocytes are either increased or decreased. So the cases where reticulocytes gonna increase is hemolytic anemia and treated iron and B12 deficiency cases. But the decreased reticulocytes seen in aplastic anemia and nutritional deficiency. So one more point to remember is normal reticulocyte count is going to be 0.5 to 1.5%. Now next slide is about Jaden staining. The Jaden staining is basically used to identify acid-fast organisms, mainly Mycobacterium. Now also there are other acid-fast structures like bacterial endospores, Cryptosporidium, Isospora, Cyclospora, Hydatide cysts, eggs of Taenia, and also a head of a sperm. Now in this staining, the primary structure that is used is carbophosphin that will give this pinkish color to the structures. Decolorizer that is used is acid alcohol. Counter staining will be methylene blue that will stain the background. Now the next slide is about PAS. The PAS staining or periodic acid Skiff staining. It will stain structures containing high proportion of carbohydrate and mucin macromolecules, hence stains intestine, kidney and stomach. This slide shows kidney glomeruli. It helps to identify esophageal candidiasis, liver in glycogen storage disease, and gastric signet ring cell carcinoma, and also Paget's disease of breast and Ewing sarcoma. All are PAS positive cases. Then again for mucin, we have Alcian blue staining. This slide represents intestine with its mucin. So Alcian blue staining can also be used for gallbladder and esophagus staining. Then we have reticulin stain, where the reticulin fibers that are gyrophilic, that's why they stain black with silver. So don't get confused whether it is green color or pink color. That is, you have to see that this black structures, these fibers are those reticulin fibers, which is the stain. So this helps to identify liver cirrhosis cases and certain tumors. Now we have The next one is about Mason trichome staining. This is for collagen, where the red one is the muscle, the blue one is the collagen, and all nucleus will be black in color. I have tried to show two different slides. Both of them represent Mason trichome staining. Then coming to next one, we have this one, Pearl's Prussian blue staining, that is for iron. So this part is the stained part. All these bluish part is the stained part. Pearl's Prussian blue staining we use for hemochromatosis of liver, asbestosis of lung, gamma bodies in spleen. Coming to our next slide, this is Voncosa staining for calcium. This is also used to stain mg bodies in malakoplakia of bladder. Then coming to next slide is also for calcium. Here it is Ali Jarin red staining is used. Next slide is about fat, and Sudan black can be used. Oil red O also can be used. The next slide is about copper. Copper rhodamine staining is used and hence helpful in Wilson disease cases. Then we have the Congo red staining is for amyloid. Hence it is helpful in cases of amyloidosis. It also stains the cell walls of plants' outer membrane of gram-negative organism. The apple green birefringence of Congo red stain preparation under polarized light represents the amyloid. Then we have the next slide is about the Masson Fontana stain that is used for melanin. This stains the melanin into blackish color. Then we have the Hall stain that is used for bile pigment, and that stains the bile into greenish color. Then we have the Gomorai methanamine silver staining that will stain fungi into blackish color. This helps to identify fungi even it is present inside tissues. Then we have the toluidine blue that has high affinity for acidic tissue components, hence used for mast cell. And this is our last slide where I am gonna share this beautiful quote stating that don't let what you cannot do interfere with what you can do. As in this period, you really need a lot of motivations, so always keep yourself motivated. Be positive. Don't worry much about your GT scores. Just keep on trying, learn from your mistakes, and work more on your weaker subjects. GT are just meant for analyzing your strength and weakness, so use it wisely. Keep revising your notes, do MCQs as well, and do not give up. Thank you.